Hello, my name's Matt. I'm going to be your nurse today. I'm going to be assessing you.
Hey.
So, here, this is yours. I'm going to provide some privacy right now for you.
Okay.
Wash my hands. Alright. And so, got some adequate lighting, and I have all my tools right here. Alright, so what brings you in today?
Oh, just a general health assessment.
Alright, and how long have you been doing these physicals for?
Usually every year or so.
Alright.
Couple years sometimes.
Alright, and how old are you?
31.
Alright, sounds good. So, what's your name again?
Naaman Luper.
Alright, and do you know where we are?
Yeah, I believe in the Davenport health assessment.
Alright, and do you know what time it is?
It's I think it's around 10.
Alright, sounds good. And the date?
Let's see. I think it's April 12th,
Alright, sounds good.
2017.
Alright, I'm just gonna inspect your skin color. Alright, and skin trigger. Alright. And everything else looks good. And you're appropriately dressed for the weather, we would say. And you seem to be a happy person. You have you don't have a flat affect or anything. That's good. And what is your native language?
Just English.
Alright. Now, alright. Right now we're going to take your vitals.
Okay.
So we're gonna start with your blood pressure.
Okay.
Here. Just get this set up. Alright, I got 119/70. That's pretty good. I'm gonna check your pulse.
Okay.
Alright, I checked his pulse, which was 76, and then his respirations, which were 14. And I did that while I did that in the second part when I was taking the pulse, just so he wouldn't alter his breathing pattern at all. And so now I'm gonna take your temperature. you in any pain right now?
Not right now, no.
Alright. Alright, your oxygen is at 98%. And then says your beats per minute is 78. So if you could just come up here and step on the scale.
Alright.
Alright. You're at 170, 178. And if you could turn around real quick for me.
Sure.
Maybe you could step forward or so when I hit you in the head. You could just stand up straight. Alright. And you can step off. And you're at 171 centimeters or 67 inches. And then I'm gonna place this approximately, or not approximately, exactly 20 feet away from you.
Okay.
And then, can you see without your glasses on?
Not too well.
All right, then you can leave them on right now. Then if you cover one eye,
Okay.
can you read this one?
Yeah.
All right.
LPED,
All right, this one,
PECFD,
this one.
EDF, CZP, FELOPZD, and DEF, POTEC, and that's about all I got right now.
All right. So you're at vision is 20/20.
Okay.
Could you do the other one? Cover the other eye.
Yeah.
Third, there.
The EDF, CZP,
Yep.
FELOPZD, DEF, POTEC, LEF, PCT. That's about it.
All
That's
right.
about it.
All right, and then that one is 2015.
Okay.
That's pretty good. All right. Maybe we could hop back up on the. All right, I'm just gonna assess your skin for temperature. All right. I'm gonna inspect your hands. No cannons, other cuts, capillary refill. Alright, that hand's good. Alright, that one's good. And you seem to have no birthmarks or anything I can see. And your skin isn't excessively moist or dry, so that's good. And then I already assessed your skin turgor. I'm just gonna make sure you don't have any lesions or anything. Have you noticed having any lesions
I
or
haven't
anything?
noticed, no.
Alright, that's good. Alright, now we're gonna assess your head and your face. Just everything looks symmetric. Your hair is in, no balding anywhere. It's good. Palpate your scalp, make sure there's no weird lumps or bumps
Good.
anywhere. And there's no bumps or lesions that I saw or found in the skull. Can you smile for me? Brown. How about your cheeks? Alright. Your temporal artery. Alright. And then here, if you can just open your mouth and close it a couple times. both eyes.
2015 in the right and
Alright,
13.
now if you could just follow my finger with
Okay.
your eyes.
Okay.
Alright, that's good. And your pupils, when they were round, reacting to light,
I'm just
equal.
gonna check your skin real quick.
And then here,
My
can
hands
you
are cold and I apologize.
can you focus on my
Yes,
can you take
yes,
can you take your glasses off, please? And then could you focus on my finger?
Moisture.
And then look at the
Skin sugar is
other wall of the room.
Mhm.
Alright, and then back to my finger. And then again at the wall.
Toes are nice and warm, legs are
Alright.
nice and warm.
Thank you. You had
I don't
had a
see
good
any
accommodation there.
lesions.
So sorry,
Do
sorry, you could leave your
have
glasses
Oh,
abscesses,
sorry.
off.
scrapes, abrasions anywhere?
Inspect.
Nothing. Okay.
Square
Your skin color is within the limits for your ethnicity.
and
Your cat refill.
I'm gonna inspect your ears.
Less
Do
than 2
you have any
seconds.
pain with them?
No.
Less
Do
than
you,
2
are you
seconds.
involved in anything that
Less than 2
are you around loud noises
and
at all?
less than 2 seconds.
Sometimes if I play the drums, it's
Alright.
pretty loud
Okay.
in there. But
I'm
Alright,
going
and then
to
do you,
just check out your scalp real quick.
use hearing protection when you do that?
Scalp.
no, I should, but I don't.
Alright.
Any sore spots? Nope. Okay. And your hair is clean and dry, no brittleness noted. Your face
Just gonna look in
is
your ear
symmetrical.
real
Can you
quick.
smile? Frown? Puff out your cheeks? Okay, I'm gonna have you take your glasses off for just a second. Alright, squint your eyes closed. Don't
Alright.
let me open them. Okay. Cranial nerve 7 is intact. And then flinch down. And open. And cranial nerve 5 is
Alright, I
intact.
can see your eardrum clearly.
gonna push it
Looks
over
like it's in
your
good
cheek.
condition. The other
Just
side.
if you want.
Oh, yeah.
Alrighty. Leave the glasses back there, sorry.
Oh, it's okay.
Okay, let's check cranial nerves 3, 4, and 6. What I want you to do is follow my finger, adjust your eyes.
Alright. That one looks good too. There's no wax buildup in there.
Okay, and then I'm
Alright,
going
and then
to
I'm gonna do a little hearing test
I
on you,
apologize,
so
it's
I'm
a
gonna
little
cover
complicated.
this ear, and then I'm going to whisper, and if you could just repeat back to me what I said.
Okay. And then
RX1.
Yep.
here,
Uh,
and then look here. Good job. Your
EVC
pupils are
two?
equal round reactive.
I said BC too.
Oh, I'm
But-
extra.
I'm going
Yeah,
to-
they sound similar.
Okay.
So now I'm gonna get, could you tilt your head up towards the ceiling? Nose looks symmetric. Right inside of there. Alright, and then you could just look at that ceiling.
Reflexes
Alright.
intact.
Everything looks good.
Alright, I'm going to check your
In there.
ears.
No excess mucus, no
Little emergency after all that,
dryness
isn't it?
at
I
all.
apologize. Any pain in your ears?
So now, could you, plug one nostril and then
Yeah.
snap?
Alright, I'm gonna walk behind
Alright,
you
the
and
other
do
one.
a hearing test real quick.
Alright, can you usually breathe out of your nostrils?
I have
good?
some more issues
Alright, have you ever
sometimes.
had like a deviated septum where it's moved to one side where one nostril's harder to breathe out than the other?
Seems that way. My brother has that.
Alright,
Cranial nerve 8 is intact.
alright. So, now I'm going to look inside,
I'm
Your
going
mouth.
to shine the light off into your nose. Abnormal inside your nose. Can you
you
press
could,
out your voice?
just open up.
Okay.
Can you push on each side of your nose and blow out?
Alright, you can say ah,
Uh,
alright.
Your nose is
And
clean.
then you could, kinda like,
And then
yeah.
can you open your mouth?
Alright, everything looks good.
Cranial nerve 9 is intact. Can you smile for me? Or you wanna open up one more time? Pupils are pink and moist.
And then if, here, if you can just open it one more time, and I'll get your uvula. You just say ah one more time. assess your neck. Have you noticed any lumps in
Not
your
that
neck?
I've noticed any.
Sometimes if you're sick, you'll have a lump on either side, which would be like a lymph node. It just kind of swells up, and you'll feel that a little bit.
Okay.
So I'm gonna find the trachea, get that, and then I'm also going to, so if you could try to relax your neck as much as
Okay.
possible. I'm just gonna try to find the thyroid. Alright. And that doesn't, if that's not swollen, watch, and then I'm also gonna palpate your carotid artery.
Can you raise your shoulders for me? Can you push them up for me?
And we only want to do one at a time, otherwise we can disrupt the flow of blood to the brain, which won't be good.
I appreciate it.
So, yeah. So, now I'm going to palpate your lymph nodes that are in your head, up, back, and then down, and then you have some right around your collarbone. So,
Okay.
Your chest rises and falls symmetrically. No abnormal movements. I'm gonna request for CPA.
yeah, I don't
Let me know if you feel anything.
feel any that are prominent or anything, so that's a good sign. If you can just move your head to the side, back, forward. Alright, and then if you can push your head against my hand. Alright. Alright, if you could try to push forward, yeah, against. Alright, good. Alright, so now we're gonna move on to your chest region. I'm gonna assess your skin. The skin looks normal, and you don't look barrel chested at all. And so if you can shrug your shoulders, and if you can push up against my hands. There. And then here, if you can move your arms behind you, can you touch them?
Yeah.
Alright. And if you can move your arms back. You can do that. Alright,
Yeah.
so your range of motion is pretty good. Alright, and then I'm gonna here, if you can just take a deep breath in. Another one. Alright, your lungs are pretty symmetric. Go ahead and you breathe in. If you could stand up, please. Alright, I'm gonna
Okay.
I'm gonna assess
Do you
your
know if anything hurts?
spine. If you could lean forward, as much as you lean, like if you're gonna stretch to lean down, touch your toes.
Gotcha.
Yeah, like that. Alright. That is good. So if you can sit back up on the table.
Alright.
You can tell me if you could face that way.
Oh, yeah, sure.
And then tell me if this causes you any pain.
Nope.
So what I do is push up on my arms.
That was okay.
Alright. And then now I'm going to listen to your lungs. You could just breathe normally.
Pulse is intact, no pulsations, no heaves. Can I listen to your heart real quick?
Alright, that sounds good. Now I'm going to listen to the breath. some simple range of motions. We already did the arms, the head, and the shoulders. So
Okay.
if you could push up against my hand, yeah.
Do you do stuff
All right. Then if you could pull down.
There's two ways to do them. Okay. You can do the circular
Push.
motion, in the
Pull.
shower is usually the best after
Push.
3 to 4 days after your period.
And then if you can,
I'm sorry, 4 to 7 days after
if
your
you can
period.
push up against my hand, push down,
Go through and start here,
push up,
because that's with the lip pump part,
push down.
and then just go around.
All right, then if you could lay on your back.
And then when you get to the nipple, just touch the nipple, make sure there's no drainage.
Um,
And you can also
actually, I'm
do,
gonna put
the
this
linear, where
all the way
um,
Carry this. All right, and then just
back and forth, up and down. And then
Does that,
also in front
no,
of your
no,
hands
we're
and
putting that.
hips to make sure that they're both symmetrical.
Okay.
One's obviously bigger than the other, everyone's like that, so don't get alarmed with that. It's best that you guys know your own breast tissue.
all right. And then if you could bring your
Some people have
knees like that, and then just flop it over onto the other one.
So,
All right, and then if you could do that with the other one. All right, and then if you could just bring this up to a 90-degree angle, can you
About
do
like
that?
that.
All right. All right. Yeah. Maybe some stretching will help you get it up a little
Yeah, it couldn't hurt.
over there. Yeah.
Yeah.
So,
Check for changes, report changes.
All right,
Focus on the palm of the
let's
hands
get
down.
here. We'll put you back up.
First 2 fingers. You're using too much pressure. The testicle is unsure, you need to go the epididymis on top. It feels softer.
all right. And now,
Straight strands of string.
do you do self-testicular exams?
I try to when I remember.
All right. Do you do it how often?
Just like once a month.
All
I
right.
think of it.
All right. Yeah, you want to do that. Approximately about once a month. You know, try to keep a regular routine of it.
Okay.
Where do you do it usually?
Usually in the shower.
All right. Yeah. You want to do it in the shower when everything's relaxed and it's just easier to palpate them. And see,
Yeah.
do you know what you're looking for?
I don't just anything out of the ordinary, like firm lumps or anything.
Yeah. Anything that just doesn't is anything that's different. Doesn't hurt to give a call. But yeah, definitely the lumps. You would want to come in and have those checked out as soon as possible. And then also, even though you're not a female, we still, breast exams, just do them. If you're gonna do the testicular exam, you might as well do a breast exam while you're at it.
Okay.
And so, I'm just gonna demonstrate like what I would do with a female patient here.
Yeah.
What ones are happening?
Right, and then if you could put one arm.
Okay.
Yeah, very nice. You'd start up in here, and you just work your way down around the breast, and just
Okay.
get in there, feeling for any lumps, and then just do a circle around it till you reach the middle. And if there's any lumps or anything, you would want to make note of those, and then you do the same thing on the other side as well.
Okay.
Just behind the head, just spread the thing out. And then also squeeze in the nipple, see if there's any discharge or anything like that. Anything that's just out of the normal. So here, you can no, you can just sit
Okay.
back. I'm gonna come over to this side, and then you lay down, turn your head over there, and just try to relax these muscles as much as you can. Right. I don't see any jugular vein distension. That's what I'm looking for. If you keep over there, I'm just gonna listen to it really quickly. Alright, sounds good. I don't hear any bruise or anything. So I'm just gonna listen to your heart.
No pre-particular edema, temperature is warm.
just gonna feel your
Okay, so now I'm gonna have you
hip
stand up.
right, right there.
I know it's up, down, I apologize.
See if I can feel that.
Alright, I'm gonna have you turn around so I can check your spine.
Alright. And I can feel that, so that's good. I'm gonna assess your abdominal. So I'm actually gonna
Straight
put you
and
down.
symmetrical. I'm
Again,
going to
sorry.
have you
That's okay.
bend at the waist.
Need to fall asleep.
Alright, so
Knee clean.
first
Yep.
I'm just gonna
Okay.
inspect it. Everything looks
Symmetrical.
Everything looks
Movements
normal.
are smooth. I'm going to
Should.
have you walk
so
to the desk over here.
alright,
And
now
then back
I'm going to
heel.
listen. I'm not gonna push before I listen just because that can sometimes move things around a minute and make it start up
Okay.
again.
Sure.
And then
Have you
walk
had
on
any
your
pain
toes.
in your abdomen at all?
No.
And then back on your
Alright.
heels. Those spurs make it a little difficult. Despite this heel spur gait is smooth, rhythmic, and effortless. Alright, so I'm gonna have you close your eyes. Hands to the side. Okay, that was a Romberg test. You did great.
Alright, I heard sounds in all quadrants. If I didn't, I would have to wait about 2 to 5 minutes
Okay.
in each quadrant to say that you have absent vowel sounds, but I heard them.
Okay.
So that's good. Now I'm gonna belt
So
back
what
down.
I'm gonna do is I'm gonna have you close your eyes
Is there any pain?
No.
and stretch your arm
Alright.
out and touch your nose.
Alright, now I'm gonna go a little deeper.
And then do it with the other one.
Just let me know if there's any pain.
And then what I want you to do is touch your nose and then touch my finger.
Alright, and I'm just gonna percuss a little bit. Percuss the liver.
Good job. Movements were smooth and effortless. Let's check for your reflexes real quick.
Alright, and then I'm gonna just see if you have any nodes that are present in the inguinal area. And then you could also palpate the femoral pulse up in there.
Okay.
We're not gonna do that right now though.
Okay.
So, here, if you could sit up again and then scoot to the edge of the.
Alright.
Alright. And then hair distribution on the lower limb seems to be good. If you ever for some reason like lose hair like in like that section, it just disappears. You may want to come in and get that checked out because that could be a problem with your peripheral blood flow
Okay.
to that area. And it's decreased, and I don't see any varicose veins at all. That's good. Now I'm just gonna palpate
Okay, so I'm gonna have you close your
popliteal
eyes.
pulse
And I want you to tell me where you feel this.
and back here, going back here, and then your pedal.
Is that like curved into your nose?
This side.
Okay. So this is gonna be soft. This will be sharp. This is dull. I want you to tell me what you feel.
And then, is it okay if I inspect your toes?
Sure.
Alright.
There you go.
It looks normal, everything looks good. We can do the other one as well.
Yep. Yep.
Alright, everything looks good here. If you want, you can put them back.
Okay.
Yeah, and I inspected the capillary refill down there too, on each foot. So, yeah, and then we also inspected your range of motion when you were on the table with your hips. When I had you flop them over to the side.
Okay.
Alright, so now, here if you could stand up.
Yeah.
And if you could walk, or if you could go to that dot on the
Okay.
floor, just walk normally, and then back. Alright, and if you could walk on your walk on your toes. Alright, and then walk back on your heels.
Thank you very much. Thank you.
Alright, everything looks good. Now if you, here we're gonna perform, called the Romberg test. It's just a balance test. Have you ever had problems with vertigo or anything?
That's my knowledge, yeah.
Alright, and then here, if you just close your eyes and then you can stay this for 20 seconds. Alright, it's been 20 seconds and you passed, so you don't have any problems with your balance, it seems like. So if you could go back on the table and scoot back a little bit. Alright, so now we're going to test your Babinski's reflexes. If we can take your
Oh, yeah.
triceps off one more time. Are you really ticklish in your feet?
A little bit.
Alright. So if we go a little harder, that usually helps out with that.
Okay.
Alright. Alright, yeah. Yeah, I mean, yeah, I'm the
It's
same
tough.
way. I don't like my feet getting touched either. So yeah, with that we're looking to see if
Mhm.
your toes fan out and then your big toe goes to the side. And if that happens, it's not a very good sign. It can be indicative of some problems.
Okay.
So, but yeah, yours were good. And so now here we're gonna, if you could just scoot to the edge of the table.
Mhm.
All right, now we're gonna check your different reflexes.
Okay.
Let's start with. All right. I can just support your arm. Alright. And then we'll do the inside. You know, these ones you might not see it as much. You're more you'll feel them before you see them.
Okay.
Alright, those are all good. Now we're gonna go for the patellar. Right there. Alright. Good. Alright, now Achilles. Alright. That's good. And then here, I'm gonna test your sensation of whether you can feel things or not.
Okay.
You can just close your eyes and tell me if this feels sharp or dull.
Okay. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Good for that one. Are you sharp there? Bill?
Yep. Alright. Here, if you can, tell me if you can, tell me where you feel this on your face.
Okay. Forehead. Left cheek. Chin. Right cheek.
Okay, and then tell me if you can feel any of these.
Yep. 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 Yes. Yeah. Yep. Feel it. Yep.
Alright. That's good. Alright, now, can you tell me if you feel this any vibration?
Yeah. Yep, can feel that.
Alright. You feel those?
Yeah.
Alright. Alright, we're also going to, just tell me if you can feel this, or, sorry, hear this.
Okay. Yeah, I can hear that. Yep.
Alright,
Oops, sorry.
no. Then if you could just hold your head straight.
Okay.
Can you hear this better on one side or the other?
Seems pretty balanced.
Alright. And then, you hear that good?
Yeah. Yep.
Alright. And then if you could, close your eyes and then, bring, one finger to your nose.
Mhm.
Alright, and then the other. Alright. Then if you're, just like that, if you could just go like that, slower than faster. Alright, that's good. And, so, you said you're not in any pain?
No. No.
Alright, and, do you have any questions for me regarding anything?
I can't think of any.
Any other tests?
No, pretty good, I think.
Alright, well then that, concludes our exam, so thank you.
Thank you.